welcome everyone back to the Dental Advocate, where the dental assistant live feeds from experience and unity. So today we got a good show on our hands. Again, I'm your host, Trinidad Mora. I have a couple of guests here today with us. I have Jazmin, who's here with us. She's an oral surgeon assistant. She has her OSMA. And we have JR again, who I think you guys saw, in a couple of episodes back.
Yeah.
So let's get started. How long have you been in dentistry?
I've been in dentistry for about 5 years.
5
Yeah,
years?
5 years. To be honest with you, I freelanced everything. One of my friends, she's a specialty assistant, and she mainly does OS. So whenever I moved back from Dallas, she was like, hey, you know what? I'm in the dental field. Let's get you in the dental field. So I would go to work with her for like 6 months. I would take pictures of everything. Work for free for 6 months.
What?
Yeah. I would travel. She'll be like, hey, I'm going to be here in Santa Barbara, wherever she was going to be at. And I would drive and I would go and work, and they would train me, teach me.
Oh, okay.
Yeah. But I didn't get paid or anything, but they pointed me to the direction of what certifications to get. And then, so I got all my certifications and hustle.
Definitely an upside to that, though.
Yeah.
That's cool.
Yeah. So
That's very cool.
I'm proud where I'm at. It's been a lot of hard work, but if you really want something, then you're going to go out and get it.
Yeah, definitely.
Yeah.
So today we're going to be talking about the difference of career experience from the men and women in our industry, and, you know, how different they're either treated or a lot of I know a lot of dentists they lean more on like hiring women.
Yeah.
So, and you know, when I first got into the industry, there was not a lot of men.
No.
I mean, we had an office full of men. I don't know how that happened.
The only females we had were 3.
Yeah.
2 offices, one in the front in one office,
Yeah.
and one in the front of the office, and the manager would just be driving back and forth.
Yeah.
That was
That was crazy, huh? I remember
Everything was male.
Yeah.
Everything.
The doctors, the assistants,
Everything.
hygienists, everything.
Everything?
Yeah.
Males.
What?
All
And this
males.
was back in like
98, 95,
7, 8, those years. And after I got out of that office, I was always like the only male in the office everywhere else I went.
Yeah.
Same.
Yeah. Yeah, it's really rare to see a male because it's more of a female dominant.
Did you get a chance to work in an office in Dallas to see if there was?
No. When I was in Dallas, I have experience in like banking, insurance, international business. But when I moved back to California, it was really difficult to find something in what I had experienced. So that's why my friend and her brother were the ones that helped me out because they saw that I was like struggling. Like I would get it in interviews, but I was struggling. So they were like, hey, we're going to help you get into the dental field and you're going to have a lot more opportunities. So that's why I decided to get in the dental field. And I wish I would have known like I was going to like the dental field because I love OS because that's where I started.
Yeah.
Like, I love what I do. I enjoy waking up every morning going.
Yeah, you were never in general, huh? You just went straight to OS.
I went straight to OS.
Wow.
Yeah, straight to OS. I never worked in the general side. Yeah. But it was a long road. I did meet an oral surgeon. His name was Dr. Anderson. He was the one, when I met him, he's the one who told me to become a great assistant is going to take you about 2 years. And he was in like.
Yeah, I was going to say that's very good.
Yeah.
So we have Ilse watching. She said, hi, y'all. What's up, Ilse?
What's up, Ilse? What's going on?
How you doing?
How are you?
Shout out to her.
Shout out to Ilse.
Let's see. So I have a couple statistics here that I want to read about our position in the industry. So here, this is a study from 2015. It's from the Oral Health Workforce Research Center. And it says that in 2015, 95% of the assistants are female with an average age of 35. How old are you?
I'm 33 years old.
There it is.
You're like
You
right
fall
there.
into there. And more than 20% were Latinos. So I do want to read one more thing. So it says the origins of the field have been traced to Dr. C. Edmund Kells of New Orleans, who hired the first female dental assistant in 1885 to provide health care to women without the need of a male chaperone. During the latter half of the 19th and 20th centuries, men and women continued to enter the dental assistant workforce despite gender discrimination in obtaining employment. Today, the dental assistant workforce is still dominated by women despite growing gender diversity. And that's so true.
That is
very, very true.
That's very
and I
true.
found that out today because I asked my IG circle a couple of questions, and I just thought it was interesting the answers they were giving me about male assistants. And I'm gonna give you guys that information a little bit later. But so here it says in the beginning of dentistry, it was thought to be that women were not tough enough for the position, but evidently they proved everyone wrong for sure.
Yes.
Do you find that it's tough physically and emotionally for you to do your job even though you work with other women?
Well,
Yeah, she looked at me like,
well,
let me tell you.
I try to be neutral because where everybody has different personalities, we all work differently, and yes, there is times where you are gonna bump heads because you may not see eye to eye, but you want to carry a balance with everybody. Stake out like what are they really good at, okay, and you want to assign what we do. It's like we want to assign, what's everybody gonna do throughout the whole day. Okay, so there won't be any misunderstanding. So like me, I'm really, really good at, the doctors always want me to run the floor because I do notes. I could do notes. I could do IVs. I could do pretty much everything. So for one person won't get mad, I'll be like, okay, so what do y'all prefer in doing? And they're like, oh, JR, I'm going to pass. Elsie, I'm going to suction. And then the other person, the fourth is going to recover and do instruments. So you
guys always use 3 or 4 assistants?
It depends on the schedule.
Oh, okay.
Yeah,
mainly, preferably 4. So yeah, so now like we have, it's all male and female.
So it's LC, you,
Yes.
JR,
and whoever we get rammed in.
If you guys get a fourth.
Yeah.
So so I try to have a common ground. Be neutral with everybody. Because not everybody's gonna get along. But at the end of the day, we have to be professional enough to carry on our jobs.
Yeah. I would have to say that I have definitely witnessed some of the stuff that goes on between the women. And I'm not saying this doesn't happen with men, because definitely it just depends on who they are.
Yeah.
But I have, even now, I'm still in an office where it's mostly women. And I remember when some of the women started, some of the other ones got a little like competitive.
Yeah.
You know what I mean? So that can happen with anyone, but since there's mostly women in the industry, I'm pointing that out. And the other thing is, I wanted to talk about some of the different things in the industry when it comes to comparing genders. So like the first one that I mentioned earlier was the preference for the dentist. Like for a long time, I think really all you saw was women in the front office.
Yeah.
In fact, in the whole industry, but mostly in the front office. And it's also the men that I first saw when I first started were either in the lab or dentist.
Yeah.
Yeah.
Yeah, for sure. So, and the other one was favoritism. So I have never kissed ass.
Yeah.
I liked working hard for what I get.
Yeah.
I just don't believe in that, and I don't like doing it. I feel like that's not me. And if I'm gonna beat someone at something, or if I'm being competitive, I'm going to do it because of who I am and what I could do.
Mm-hmm.
But I have also seen
a lot of
where
a lot of that. A lot. Like move away.
Where even though I'm like outperforming someone,
yeah,
and then they just come and like,
when we used to work at the office together, remember?
you know, they come in all pretty
Yeah.
and like there, that's it. You know what I mean? It's like, dude, come on. Like the doctor's already like, you know,
Yeah.
you go or you did. You know what I mean?
No, but and that if for whatever reason something happened backwards, so they're like, "Oh, can you bring him instead?" Oh man,
Yeah.
they would be pissed off. Like, why?
yeah.
I've been here 6 years.
Yeah.
I've been here
I
for
have
5
seniority.
weeks.
Yeah. It can happen
Yeah.
both ways
Yeah.
It does
because
happen.
I know that I've been at an office where there was a girl there for 14 years. 14 years.
Wow.
I'm there my first year, and the doctor's like, you come assist me, or you do this, or you do that. And she's like, whoa, what am I, chopped liver, you know what I mean? And so she was like, no, I'm going to go help him. You do this. And she literally told me, I've been here for 14 years, and I have seniority. And I was like, okay. Like, I didn't want to argue with her. So I was
You
like,
don't
all
wanna
right,
make her feel
cool,
bad.
whatever, you know. But, you know, those are the kind of things sometimes that arise from also these doctors having or preferring women or men in the industry, whether it's front office or back office. I think those are, you know, some of the issues. And the other thing that I wanted to talk about was pay. You know, I think this goes across the board in most industries. But in the dental industry, I read that women get paid 80% of what men get paid. So you guys get 80 cents for every dollar that we get.
There you go.
And that's crazy. I mean, it obviously it shouldn't be that way, but I didn't read any further to know why that happens. But I know that it also has to do with looks, and it has to do with height, and it has to do with the person's demeanor and the position or title that they're in. Isn't that crazy?
That is interesting because, but it's sad to say, but believe it or not, that it can be true.
Yeah.
You know? But it's just like, okay, like one person may have experience, a whole lot of experience, and here comes this person just because, you know, whatever, you know, how they look or, you know, the work ethic, it's like they get paid more than when the person has been in the field for like many years, you know. And it's just like it has to come hand in hand, because it's just like, I think now it should be more important to do more like working interviews to actually see exactly what the person is all about.
Yeah.
You know,
Yeah.
because I may come and say like, oh yes, I'm expert in like, you know, in OS, I could do this and that. But at the end of the day, when you put me in there and then be like, wait, I thought you say you knew how to do this and that, but then you don't. And
Yeah.
then
But see, you're also one of those assistants that I've seen work, and I know you can work. I know you can work hard. I've seen what you can do.
Oh.
So most of what you say, I know that you can back it up. You know what I mean?
Yeah.
Oh, we have Rochelle Foote watching. She's one of the girls in our IG circle. How's it going, Rochelle? I'm glad you made it. She told me she was gonna watch. It's because she's in Arizona, so she's about an hour ahead, I think.
Okay.
Yeah. Oh, my brother's watching too. He said he wants to see you choke someone out. Well, it's not gonna be me. It's not gonna be me. So
Yeah, no, it ain't.
I'm harmless. I don't do it. Let me guess who it is, Mario.
yeah. Yeah.
I always choke somebody out. You always tell me that.
Put him in the headlight.
Yeah, all the time.
Yeah.
Harmless.
So do you guys have any stories about maybe seeing a woman or a man get treated different, or a situation where a woman had the upside or a man had the upside in an office?
I feel like I'm on the
I know I've seen it. There's one instance when I first went to oh shoot, I shouldn't say the office.
An office.
In Ventura. There was an office in Ventura.
I know what you're talking about. Because I know exactly what you're talking about. Which office?
So there was again, like, you know, like a circle of people.
And I don't know who you're talking
that
about.
stayed pretty tight.
Yeah.
You know what I mean? That stayed pretty tight, and no matter how much talent you had, no matter anything, like, that circle was pretty sealed. You know what I mean? So that also, I think, it creates an issue in the office, whether the doctor wants it or not.
Mm-hmm. Yeah.
And you know, the doctor's in the circle, so obviously he's enjoying it, he's creating it, he's supporting it. So sometimes it's tough to get into that circle and infiltrate and say, okay, now I'm part of the circle. So that's also creating a lot of issues between employees and other people in the office. And that's, I think, part of that favoritism that I'm talking about.
Yeah, that's true. To be honest with you, when I was starting, I did see that a lot, you know, because when I got into the dental field, I didn't have that much experience. So when you start somewhere fresh, they already have their teams, okay? So they're like, okay, you're new, you're barely starting in the dental field. So yeah, I would see it like, okay, so we're going to have you just dismiss or just do instruments, you know. I'm going to have so-and-so in the room because, you know, they've been my assistants or for
it happens a lot
very
like
long,
that, yeah.
you know, time. So that pushed me more to become the best I can.
Yeah, that's good.
And
That's the right
yeah. So I was
attitude
like,
to
you know
have.
what? I'm gonna come back and show you that. You know what? I'm gonna dominate this.
And it's not just about showing them. It's proving to yourself that you can rise above some of the negativity that's going on, or whatever, you know, you feel pushed back for.
Yeah.
You know.
It's tough. It's tough because there's times that, you know, you're like, well, if you show me, I can learn. You know, it's not fair to just push somebody out just because they don't know how to do something. It's like, okay, like, you can lead a horse to water, but you can't make it drink. So people that are actually gonna want it are actually gonna sit there and like learn. People that don't want it are
There's
just gonna.
people that don't.
Yeah, that just are just gonna be like, okay, and just there to get a paycheck.
Sometimes we get people like that.
Yeah.
That I don't know how to do it. I don't know. Can you go do it? And we're like, if you don't do it, you're never gonna learn how to do a certain. It can be something tiny or small. They just don't want to learn it. And me and her work with a lot of people like that.
And I think part of it is not that they don't want to learn it. I think the other part that's connected to that is that once you know that they know how to do it, that means that you can always ask them to do it, and they don't want to.
Yeah.
Yeah, imply more work on them.
Yeah, more
But
responsibility.
but it's just like, okay, you're not gonna, if you want to be great at what you do, then you're gonna have to learn. But, you know, believe it or not, like, doctors, managers, whoever, they all see that. They may not tell you, but they see who their people that always come to work and give it 110%, and who people are just like, okay, they just don't. We taught them a lot of times, and they just don't want to learn. You know?
But there's doctors too that know when they see a certain assistant, they're like,
and it sucks, you know, because it's just like, we're there, like, I'll train you. Like, if you ask me how to do something, I'll teach you, you know, because I've been there. We've all been there that we don't know how to do something. We weren't born knowing this.
I didn't know damn thing.
So Orlando's watching. What's up, Orlando?
We
We gotta have you back on the show, man.
Yeah.
He said dream team right there, true surgical crew.
Dream team.
Órale, no gang signs.
It's peas. Brother.
He said we treat JR different because of his sexy legs.
Órale.
What did you show him?
I don't show nobody nada. Watch out. Like that.
You can stop a car in mid road, huh?
Ready?
You want him to catch a taxi? Just show his legs.
So Jazmin, Ilse wants you to tell them how some doctors prefer women for the anesthesia part. Why is that?
No, go ahead. Depends, but yeah.
Yeah, it depends because there has been like cases where inappropriate actions have happened. So that's why they prefer a female in the room whenever they're doing surgery on a female.
That's definitely understandable.
Or not only the surgery, but when the
the recovery or, if
surgery.
Yeah.
But I think that's also, I see that you guys call in whoever they came with in the recovery
after they calm down.
Yeah, after they're a little bit more awake and aware, then we'll bring back the driver.
Yeah, because if you bring the driver back when they're like hysterical, crying or whatever, they're gonna think that we did something to them. Yeah. They're gonna like, what did you guys do to them, him or her, or whatever. So when they're calm down, that's when we bring the driver in.
Yeah,
that's a good point.
So yeah, that's why in a lot of these cases, if it's a female patient, preferably there's always a female in the room. That for that reason.
So, Rochelle, by the way, Rochelle on IG is at the Dental Assistant Life. You guys give her a follow. Check out her content. She's got great content.
Follow you.
She wants to know, how do you get around favoritism? I don't know that there's a right answer for that, but I know that one of the things that you can do,
I don't think there's a right answer. No, there's not.
One of the things you could do is continue to expose the other person for who they are. Meaning, don't sit there and complain about them. Don't be the tattletale the complainer. Yeah. What you want to do is, through your actions, expose who they are and how they're being in front of the person that should be seeing it. To me, that's the only thing that I would think of. Yeah. I mean, because if you start being the initiator of problems in the office, that's not good either.
Yeah. I totally agree. Just go there, do your job the best you can, give it 110%, and just go there and just be you. That's it. That's all you have to do. And at the end of the day, if you still don't feel comfortable, then that's not part of the place for you. So.
Yeah, one of the other things that Orlando's saying is teams are teamed up to balance each other out. He said, I've been in dental for 2 decades and I'm still learning.
Yeah.
Hey, we're all still learning, man.
Never stop learning.
Every day. Every day you learn
something new. Yeah, exactly. Yeah.
So, what do you guys think about some of the things as far as man versus women in the field? It says patients feel more at ease with women. Do you guys think that's true?
Go for it.
Well, it depends. A lot of women like when there's a male in there, when they're getting a filling done, because I've been in general for a long time also, and sometimes it's backwards too. Men prefer a woman in there assisting or helping or whatever the case is. I've seen that many, many, many times.
Yeah, I mean, just from the first office that we started at, it was all males. How many assistants did we have? 10, 12?
Around,
I don't know, somewhere around
11, 12, yeah.
Oh, wow.
It was a lot of us.
That's a lot of you guys.
Yeah, well, we had 2 offices, so we had like a traveling crew.
We used to see 1 doctor, 2 assistants, 60-some patients a day.
Wow.
Yeah, it was.
Yeah, we would call each other. We would call each other. How many have you seen? 50. We've seen 70. Yeah. We've seen 70.
I remember that.
Like, man, we'll be all pissed
we would
off.
compete with each other.
And then we'll be mad driving back from Santa Barbara, like, when you saw 55.
And they saw 70.
Yeah.
But you gotta, that office, because it was all males, a lot of women used to come to that office.
That's what I was about to mention.
A lot. They would come like they're going to the club watching like that.
Yeah.
Like that with their heels on.
They would, man.
Big, back in the day with the big hoops. I'm here to see doctor.
I don't want to mention.
The bigger the hoop.
I don't want to mention like any names, but there was days where, I don't know what to say this. There was days where we had girls waiting for us that were our patients after work, and we'd go take off. and
No, you
chill.
know what was a few times they would call like, oh, we was there. Is JR there? I was just there like 10 minutes ago.
Yeah.
And we're like, there's some girl in the phone for you.
Oh my
Because
god!
the
you
women
guys,
that we work with didn't, like
Yeah.
calling, and we're like,
you guys
okay,
had fan
hello?
club.
no, you don't
Dude,
understand.
it was
I was like,
crazy.
hello, if you look outside the window, I'm outside.
Yeah.
I'm like,
Dude.
and I was like, I can't. Hold on, I'll put because I wasn't part of it. You go. What? Did you forget something? Oh, I was wondering if you want to go to dinner. It's on me. It's on me. I'm like,
It's on
okay.
me.
Pick me up later. Okay, bye. No, but it was like that though.
Yeah.
Like a lot of people would do stuff like that because we're all males, and it was just to me it was a little weird because
And
Yeah, that's
we were
really
17,
weird.
18, 19, so we were like at our prime of just being
17,
like
18,
brave,
19,
you know what I mean?
20, 21. We were like
Yeah.
really young. We were like,
Yeah, we would go to dental conventions and
well, the
we'd
dental
walk in like a
conventions,
freaking
Really?
I like that.
entourage.
It was like a big group, like you said, like
Yeah.
a huge group, all guys and like 3 women.
Oh my god!
But they're always like
Yeah.
in the
Yeah.
side or in the back. We're like, we would get rooms.
Mhm.
We would get rooms and just,
you know.
no, like a room and have like a party and stuff like that with each other. And then from there, we just go out and do stuff. You know what I mean? But
Yeah.
it was like all males. All males.
My goodness.
So one of the
Yeah.
other things is they say that men have a heavy hand
Mm-hmm.
in dentistry. I don't know if that's true, man.
Well, now that I'm doing OS, it's yes and a no.
Yeah.
Yeah.
Yes and no.
there-
And why
there's-
why did you notice that now that you're doing OS?
Because when you're asleep, they're more like they retract your cheek a little bit harder. They
I
do
see
this
what
a
you're
little bit
saying.
harder. When you're doing like a local anesthetic, you're more calm. You
Yeah.
retract more, gentle and stuff like that. But when you're out,
Mhm.
you move the head, you move the face, the chin up, chin down, stuff like that. It's
Yeah.
more.
Yeah.
It's
Well,
not
you know,
that they're heavy-handed. It's a little bit more
I was just talking to
aggressive.
Zeke, which is our sound engineer,
Yeah.
and he was just saying how awesome everyone was at the office because
Oh,
everyone was so
that's
nice.
right.
And you guys don't remember him?
I remember him. We extracted his wisdom teeth.
And I remember
Right?
him before,
Yeah.
before,
Yeah.
yeah.
Yeah, I remember him.
Like,
I was
didn't
in the
want
surgery.
you? And I go, yeah, that was me.
Yeah.
So yeah, he was complimenting all of you guys
Oh,
for
cool.
all the work that you guys did. What do you guys think about patients coming back because the hygienist is pretty?
Oh, yeah. Yeah. Especially viejitos, like older people.
Yeah.
No, I'm being serious.
Yeah, it's true.
Or if it's
I
a
can't
male
tell you how many
hygienist.
of our patients that are a little older, they'll schedule, and if they're not there, they're like, nah.
But not only hygienists,
Really?
even assistants. Sometimes they would call and say, "Is Trini there today? Cause he's gonna do my this and that." And we're like, "Oh, he's not here. Can I reschedule?" or me or
Yeah.
somebody. But hygienists, when the office we used to work in, we had. They weren't all pretty, but there was a lot of pretty ones, and they would only schedule with that one person. And you can see the follow was a lot of males.
Yeah.
A few.
You know, I gotta say it's true. I agree with
yes.
this because, and that's one of the reasons that I think doctors prefer a girl or a woman in the front office, because it's a softer approach from when you walk in. You know what I mean?
And
I think
especially like we travel a lot.
Mm-hmm.
How many guys do you see in the front? I don't see a lot.
Not that
There's
many.
a few
There's
that
only
you see.
there's only a few.
A few guys that you
But
see.
you see just female.
Not too many.
No, not too many.
Not too many.
Yeah.
Yeah, that's true. When you don't really think about it until you point it out.
So here's a when I was getting yelled at before the show started. I was getting yelled at for it. Okay, some dentists like men over women
Gotta
because
check
women
class
call
already,
in
like-
sick more often. Is that true?
That's not
what?
true.
What? Say it again.
That some dentists like men over women because women call in sick more often.
No, that is not true because
My stomach hurts.
No,
my
no.
No,
period.
if I've seen both. Okay, like women because something happened with their kids or something. Well, it's understandable what happens, you know.
Yeah.
But just to call out, I don't think that's true. Just to call out, I don't think that's true. There's some people though that we work with.
Yeah.
That we work with. They're like, I'm like that. Like no, like, but there's people like that. But sometimes because families involved, kids, it's understandable. But just to call in, just for the hell of it, no.
No.
I don't think that's true.
I actually had an experience. Like, I would still go to work if I'm sick, no matter. If I'm dying and I can't get up, then that's when I call out. But there was a time that I had gotten, I don't know, some type of food poisoning, and then I called my boss. He wasn't answering. I was like, oh my God, like, what do I do? So I was still driving to work. So I pulled over like 5 times.
I remember that time.
And I was like, oh my God, like, I felt bad
remember
because
that.
they had a full
I
schedule.
remember that.
And I just didn't want to, like, I'm like, man, I'm going to go. Stick it out. And I was like, and then he finally, like, answered. He's like, yeah, what's going on? I was like, dude, I got some type of food poisoning. I've been throwing up. I pulled over like 5 times. Like, I just didn't want to call out just to call out, like, because we had a full schedule. He's like, I was like, so what do I do? He's like, turn back around, go home. He's like, I'm going to figure out who I'm going to get out there. So
when was the last time you called in sick? Oh, wow.
I don't remember you calling in sick. So for me, that was at one time.
When was the last time you called out? It's been a while?
It's been a while. Yeah, JR was so, like
me and her don't really call in sick.
I called out.
I was really sick one time in one of the offices in Northridge, sick, and it was summer. I had a fever, really bad. And I was like that. Like that, I can't breathe. I was like really bad, right? So they're like, "What are you doing here?" And I go, "Well, it was perio."
Yeah.
And perio, it gets even crazier than OS sometimes. Like it gets really bad. So it was just 3 of us. It was like 3-ish, 3:30-ish. They're like, "Go home." Like, no, how am I gonna leave you guys? You guys are like super busy. I was so sick. I was driving home and it was even hotter. I had to pull over, go to McDonald's, get ice waters, and I had to fall asleep like this with the bottles in me. And I was so hot, and it was summer. I was like, I'm not dying. I couldn't go get home like that. And I couldn't get home. Like when I got home, I was like, oh my God. We hardly ever call in.
It's tough. There are people that just if they are sick and they'll just call in, but I can't because it's just I think about I look at the schedule and I'm like, just by that one person calling out could just ruin everything.
Yeah, definitely.
And it's just
so
like
I got some. Orlando says, my female staff works hard and very rarely called out. So there it is. Yeah. And it says JR called out. He had a dead battery.
Oh, no. If he's talking potato chips, let me tell you what happened. Don't start, Orlando y Baluta, nadie huele más barato. Let me tell you why. Let me tell you. That day, yes, I called. I got stuck in the gas station in Camarillo. Camarillo for people that don't know what that means. In Camarillo, I got stuck, right? So then I called Orlando, man, I'm stuck right here. My battery's dead. They're like, oh, where are you working today? And they go, I'm working here. So let me check. Oh, there's no doctor today. So, toma, patos chiclotes. So I get there. There's not even an office. There's no doctor. And I'm like, oh, don't worry. Just go back home. And I go, how? I'm stuck. My truck battery was dead. So, yeah, I didn't call in. It was just a misunderstanding with the schedule. We didn't have a doctor that day.
Like you.
And lucky me, but I was stuck there waiting like that, watching it like that. waiting for somebody to get me. So I called a friend and they picked me up. So yeah, I didn't call in.
No, you got in.
So Elsie's saying, I think that sometimes the younger citizens, because they have that feeling of the responsibility.
Yes.
So they don't really care if they lose their job, you know what I mean? Like, they just kind of like, it's just a job, not a career, you know what I mean? So she feels like it's the younger ones that
she's telling you.
tend to call out.
That's true. A lot of people just don't have that heart to work.
Drive yet.
That drive, they don't.
They haven't found
you get it with your years of experience that you love what you do.
Yep. Absolutely.
And so one of the things that I was communicating with my IG circle, they mentioned a couple things that I want to say. And this one is, well, before that, I do think that in a female-dominated industry, I do think that males smooth over some of the hard edges that the women have from being around each other all the time.
We balance it out.
Yeah.
It does give some balance.
It does give a little balance
Yeah.
because if there's only women,
Just a lot of estrogen.
Yeah.
A lot.
a little, yeah, it gets like
You
that.
try to eat.
So like when they see a guy coming, they're like, all right,
Yeah, that's
gonna-
how, that's
right?
how
Am
we
I
do
right?
it.
all right,
That's
this
how-
dude's
that's
gonna balance
exactly
it out.
what it is.
You know, he's gonna balance it out like that. Yeah, right.
So I'm gonna read a comment. I'm not gonna say who it's from because I couldn't find who it was from actually, but it was online on a forum. But it says, I like what they said, so I just wanted to read it. It says, I would love having male dental assistants in my office when I'm a dentist. A lot of the female assistants I have been mean out of jealousy or some other reason. Grown women. They fight, they're catty, and they feel like they have to compete and keep up with each other, etc. Not all women, but some. Please don't attack my post. Men are more calmer, more chill, and less high-strung.
Yeah.
You guys think that's true?
They're like I said, it
Not
comes.
him, huh?
Not you. It yes, like men can have like this certain charm to speak to patients, but so women too.
Yeah.
There are women, yes, there are jealous, but there are also women that are kind and that are not jealous of one another type of thing. Okay? So whenever I think you can feel that out whenever you interview somebody. You can feel
Yeah.
like what type of person they're gonna be.
I would disagree on you. I would say that not all the time, and not everyone has that eye for that. But I do agree that if you pay attention to certain things, ask certain
Yeah.
questions, you can feel
can-
that out.
you
Because
yes.
remember when we worked at a certain office in Oxnard, when there was interviewees that would come in to get interviewed, and one of the female assistants like, who's that?
I know what you're talking about.
Who's that?
At the interview, not
At
even
the
working
interview,
there
not
yet.
even
I remember,
working.
yeah, I
They're
know.
like, she's gonna work here, like that.
Yeah,
And I'm
yeah.
like, I don't know. What are you talking about? Go to the office? No, you know what? Don't go to the office. Like that. Already
Yeah.
jealous with
Yeah.
the male people that were
Yeah.
working there. Don't go. They go, now I'm going. So I would go. I'm like, oh yeah, maybe she's getting interviewed. Let's see how long she lasts here.
Yeah.
I'm like,
yeah.
like what? like you don't know she's a rep. You don't even know what. And they're already like, let's see how long she lasts here.
Yeah.
Wow.
Yeah, it was
Yeah.
bad. It was really
That's
bad. And
I guess in a sense, I never really like experienced that. I didn't really feel that because I'm a guy. So I haven't. If the dentistry was dominated by men, maybe it would definitely be different. You know?
yeah.
Yeah.
We wouldn't feel so like, hey, like this is cool. You know what I mean?
Because when there was guys interviewing, we're like, hey, it was, like different.
Yeah.
But the women were like, nah, it wasn't always pretty.
So this is from at Dental Vibes 17, and you guys can follow her on Instagram. She's got great content too. She's part of my circle there. She's out in Florida, by the way, and she works at a private practice. She said that she has seen that some male assistants that are actually better with patients. Of course, it's an observation and opinion, but it goes to show that we male assistants can also be tender with our patients. Yeah, for sure.
Yeah, I agree.
They also mentioned that they've seen some male assistants who were dentists in other countries, and they sucked.
Bad.
And I mean, I can't tell you how many times an assistant came up to me. Well, and they're most of the time when they're dentists in other countries and they start working here as assistants, they're a little bit older.
Yeah.
They're a little
So
bit
they
older.
don't know.
And
Yeah.
some come in with their, pounding on their chest, like I'm the shit, or, you know, but most of them, some of them come in trying to teach you something. But if you don't take it the right way, you feel like they're trying to step on your toes. But for the most part, honestly, I kind of agree with her. I haven't really seen an assistant that has been a dentist at another country that came here and even still went through the dental assistant program and impressed me. I don't know why. I don't know if it's just a different work ethic or I don't know. But they work hard, that's for
because
sure.
they're used to being.
Híjole. Ya se nos...
Yeah.
Earthquake!
Guáchale.
Yes.
Hit the table! Like that. Duck, cover, and roll. Well, that's a fire, no?
Hey.
Yeah, duck cover.
Hey, we're not in a building.
Estamos en Las Vegas.
And I was like,
Good, man. That's why we do things live, man. It's
Yeah.
all right.
yeah,
It's all right.
things like
Just
this.
little- Like, remember the Super Bowl cuando se cayó like that? Mira, guacha. La same thing. No,
Same
que esta no era
thing.
teta,
Nomás no
ese
hay
era
chicha, ya
el
atrás.
pinche edificio que se cayó like that. It's all right.
No más que este no es el
No sé
Super
qué.
Bowl.
Este no es de super tazón. No. No, sorry. Okay. Continue. Oh,
It's a comedy live show.
always working with me.
Yeah, it's
¿Verdad,
never
vos?
a dull moment.
So,
Terremoto.
Ay, ay, otra
No
vez.
empieces.
it's all right.
Ahí va, ahí va.
So, this is from the same person, Dental Vibe 17. She wanted to know how I became a dental assistant and what drove me to the industry. Well, I'm going to tell you the short version because the long version is on my first episode. So you got to go watch the first episode.
Yeah.
How I became a dental assistant? Honestly, I didn't know I was going to be a dental assistant. My best friend's mom was a manager at a dental office, and the junior year of my high school, we were always getting in trouble together. Like, we were always doing something. So she pretty much just grabbed us and said, hey, you know, for this summer, you guys are going to do this. And we're like, all right. So she took us to the office every day for 3 months, and she showed us the front office. I didn't start off in the back office. I started in the front office. And then the next summer, she showed me the back office, and that's when I really, really, really liked it. And I decided to actually just stay in dentistry. So that's one of the reasons that I got into dentistry. Because when I was showed the back office, the first thing I liked was temporaries. I've been drawing all my life, and I always liked whatever got my brain high from eye-hand coordination, which is when you draw. So making temporaries was like, and still to this day is my favorite thing to do. But yeah, watch the first episode, and you'll get the long version of that. And last but not least, I have also Assistant Becky on Instagram. She's from St. Louis, Missouri. She's in a private practice. She's also worked with DAs and hygienists that were doctors in other countries. And she was just mentioning that she had a good time with them. She doesn't have any negative experiences with them. So I do want to read one thing that she wrote. So it says, I feel like the Midwest is way more female dominated than the East and West Coast. The doctors are more accepting of males. Maybe the doctors feel threatened because of there's another male. That's possible.
Yeah.
And that the doctor needs to be the big guy telling the little ladies what to do. She's like, who the hell knows? Maybe, she has a good point too here, because maybe the schools, the way they market, in fact, most of the industry markets towards women. Most of the products that are made are more geared towards women. If you notice the scrubs, there's like 100 lines of scrubs for women. For men, there's like 2.
if you go to the
and they're
the
like,
place, it's like
have a pocket and 2 pockets here, and that's it. Like,
No,
you know
you
what
walk
I mean?
into the
No,
store.
now there is.
you walk into the store, you're like, where are the guy ones right there in la esquina,
the
right
corner.
there.
The corridor.
The ones that are
just-
the ones on the floor, those are all for
Just
guys.
pick them up, go like that. Yeah,
Yeah.
mira.
Yeah,
But the colors don't match. It's okay. Wash one more than the other, and they'll be the same color
Yeah.
next month.
yeah.
Yeah.
You know, and I think also she says maybe it's our industry saying guys are supposed to be dentists and not assistants. Everything dental assistant related in ads and swag, etc., is dominantly promoted to females. Yeah, and I think she's right with that comment. And there was one guy that left a negative comment for us in the industry, and I wanted to address that really quick.
A ver.
It says, if you have an ounce of pride as a man, you shouldn't be a dental assistant. Where is the ambition, dog? I don't care if you're only doing it for the experience and you want to be a dentist someday. We're no longer homies. So just so you guys know, this guy spelled dog, D-O-G-G, and he spelled homies, H-O-M-E-Y-S. So that just goes to show this guy is being fake as fuck. Second of all, he's so close-minded about just his perspective is just so shut off. I'm so annoyed at this guy right now. But anyways, yeah, someone took a shot at us, and I just wanted to tell him fuck you. So yeah.
So there
A
you
la
go.
Berg. King Young.
So that's it, guys. Let me see if I think I addressed all the questions here. Oh, Ali's watching. What's up, Ali? How's it going? You know Ali, right?
Yeah, I know Ali.
Yeah.
Where's
All
he
right,
at now?
guys. So we come to a close. Thank you guys so much for being on the show. I had a good time with the earthquake and all.
With that, yeah, we got
Yeah.
all this.
Chicken con se subió acá.
Hey, no te muevas.
Don't move like that. Don't breathe. Don't breathe.
I want to give a shout out to all my specialty assistants and my boss Orlando and Lana and
Lana.
Elsie and Jaimito. He's like, you better give me a shout out.
Everybody wants
Oh,
to shout out.
Jaime,
Yeah,
those
yeah.
are- Okay, what's up,
we
Jaime?
didn't forget about you and all my hardworking assistants
Yes.
in the general side and the specialty side everywhere.
All right. Well,
Thank
we'll
you for
see you
having
guys next week. I'm not sure what we're going to talk about yet, but I'll be posting it. And like I said, keep it positive and hope your suction never fails you. Peace out, guys.
Mama le.
No,